All right. Hi, everybody. I asked Brittany Wagner to meet with me today to go over some of these questions that are coming up about Medicare now that we have the COVID-19 thing going on. And she owns her own billing company and virtual assistant company. So I thought she'd be a perfect person to ask about this because she's billing all day, every day, and she's like on the front lines with this stuff. So do you want to introduce yourself, Brittany? Tell us a little bit
Hey
about yourself.
everybody. Yeah, I'm Brittany Wagner, and like she said, I own Tidemart VA Services. It is a billing company, and we offer scheduling and credentialing as well. But I also understand you guys' needs as practice owners as well, because I'm a practice owner myself, and I'm a clinician, I'm an LPC, so I understand some of the struggles that we're facing.
Yeah, thanks so much for doing this. This is going to help everybody just get some clarification. So we came up with some questions, and then in the Facebook group, some people had some questions too. So we just sort of compiled them all, and we're going to try to answer them the best we can for you guys. If you have any other questions after we're finished, just drop them in the comments, and Brittany and I will come back and try to answer them to the best of our ability.
Mm-hmm.
Okay, so let's see. The first thing that we were talking about is, so what's your understanding of the new Medicare telehealth rules now that the COVID-19 has hit? Because I know there used to be a lot of restrictions with Medicare and telehealth. So what have you seen has changed now that this is going on?
The way that Medicare was working is that if you were going to be providing telehealth services, that the client would still have to come to a facility where they provided telehealth services and that they were approved to be able to utilize those telehealth services. That has been waived indefinitely now. So that means that you can see them at your house and they can see you at their house as well, and there shouldn't be an issue with reimbursement with that. And also what it means is not only are they covering services via video, like using Doxy.me or Zoom or something like that, you're also able to provide telephone visits as well.
Yeah, that's amazing. Gosh, I hate that this is going on, but I hope it really changes the way we're able to see Medicare people, because it was so restrictive before.
Mm-hmm. And when you think about it, with them being on a limited income, sometimes they don't have transportation to get to and from the facility as it is.
Absolutely. Yeah, you would think they're the population that need it the most from home.
Mm-hmm.
But yeah, so I hope this really changes that. Okay, well, thank you so much for that. Let's see. Okay, so the other question that's been coming up a lot is, how do we bill for phone calls? CPT codes, do we need to use any modifiers? These are questions that keep coming up in the group.
Yeah, so if it's anything that's under 30 minutes, I would encourage you guys to use the following CPT codes that I'm about to list. But if it's anything over 30 minutes, Medicare has waived you don't have to use the CPT code for the telephone visits. You can keep using your 90837s or your 90834s, as is tradition, and you would just put a modifier of 95 in there.
Okay.
It used to be a modifier of GT, but as of March 30th, they've done away with that, and it's a modifier of 95 now. So the CPT codes for telephone visits, specifically for counselors, so if you're doing therapy, this doesn't apply to doctors. Their CPT codes are different for telephone visits.
Okay.
The CPT code to use is 98966, and that's for a 5 to 10 minute phone call.
Okay.
There is 98967, which is an 11 to 20 minute phone call, and then there is a 98968, which is a 21 to a 30 minute phone call. If you prefer to use the telephone visit phone calls, you can keep adding those and just putting additional units until your time accrues accordingly. If you're, for example, if you're trying to make a 45-minute phone call, you could use a 98967 and a 98968 together to equal 45 minutes.
Mm-hmm. Okay, and then to bill it, you just list them on the HCFA 1500, the CMS 1500 form, just one after the other. Okay.
Yes. Mm-hmm.
Okay. What is that? This is off the questions, but what is like an average rate that people bill for those codes? Do you know?
I've seen it range, and it just varies so much region to region, but You would want to make sure that it adds up to whatever your standard fee is that you typically bill. So if you're billing $175 an hour, make sure that you put in your rates to add up to $175 for each of those units that you're using.
Okay, gotcha. Okay, yeah, that makes sense. So just make sure the numbers add up, whatever you charge. Okay, gotcha. So were you saying if you bill the phone codes, you need to use modifier 95, or you do not need to use a modifier?
You're still going to have to use modifier 95. They ask that you do that as of their press release that they put out on April 3rd.
Okay, that's great to know. Thank you. So if it's like a 45-minute phone call, for example, and you're doing therapy on the phone call, you would probably advise just to go ahead and do like a 90834 instead of using those phone codes?
Correct. And one
Okay.
thing to really denote is that their press release that they put out on April 3rd, they are requiring that you use a place of service location code of 11, because they want you to just use it as if you were actually seeing the person face to face. And for the reason for that is because if you used it as an O2 service location, then you would be getting reimbursed at the non-facility like rate, which would be less than the facility rate, which is higher.
Okay.
If you have previous claims, you need to go and resubmit them so that you can get reimbursed higher.
Okay. So if you were submitting at O2, go back, resubmit at 11 instead.
Yes. Uh-huh.
Okay. And if somebody is just a telehealth provider anyway, just like an O2 usually, would you still just do the 11? Because I think I saw that question come up on Facebook. Okay, so just do the 11, because I guess it's our home office anyway, so it just counts the same. Okay.
Yeah, and I think that they just did that, one, to make it easier on everybody who was billing, but also because the way that the way that Medicare has their system set up is it would be a non-facility rate, and they can't go in. It's a lot easier to just say use the service, use the place of service 11 code than it would be to go in and change every single non-facility rate to what they need to, and then change it back once all of this is over.
That makes sense. Okay. Yeah, thank you. Okay, let's see. And I think some of these questions are going to be overlapping, so if they do, we can just kind of skip around. But let's see. For the phone sessions, do you think people are actually going to get reimbursed for those? Like, have you seen people getting reimbursed?
Yes, I've seen people getting reimbursed. We have a practice up in New York who's successfully been reimbursed for both physician codes as well as non-physician codes for telephone services.
Oh, that's amazing. For Medicare or
Yes.
or the commercial providers?
For Medicare specifically. With the individual, with private insurance companies, it's hit or miss with them.
Okay. Yeah. Okay. Gotcha. All right. Let's see. So let's see. We addressed that. Is it necessary? Oh yeah. Is it necessary to use the phone codes right now? It's not necessarily needed if you're already doing like a therapy session, like we were saying before. Just do the regular therapy code that you would use.
Mm-hmm.
Right.
Yeah,
okay.
But if they do like a brief check-in or they have a question and it's less than 30 minutes, use the phone codes so that you can get reimbursed for something.
Okay. Okay. And those reimbursements you're seeing in New York, are they paying like regular therapy reimbursement rates, or okay. Oh, that's great.
Yes.
Okay. For the phone codes.
Yes.
Excellent. Oh, that's fantastic. Okay. Thank you. Let's see. Okay, for telehealth, what modifiers and location codes should we be using right now? So we kind of addressed that with Medicare, but I wonder if you could just go through and say, like, Medicare, this is what you should use. Commercial providers, this is what you should use, just so people.
Mm-hmm. So for commercial providers, all of them pretty much ask that you use a modifier of 95.
Okay.
Very few ask that you use a modifier of GT. I maybe have come across one, and we bill for people like in a bunch of different states. And don't ask me what it was because I can't remember.
Yeah, that's okay.
And then for Medicaid and Medicare, typically they had asked that you use a modifier of GT. Medicaid is still pretty much holding true to that in most instances, that you use a GT modifier. Medicare has switched fully to 95 now, so you don't have to worry about that. I will say, if it comes back as denied, if you use one of the modifiers, resubmit it with the other modifier. It's a lot quicker, and to just go ahead and resubmit it with the original claim number that's attached to it. And the reason why I say that is because hold times with insurance companies, if you can get a hold of anybody, are averaging about an hour and a half right now. It's a lot easier to just resubmit and see what happens.
Okay, yeah, so don't like fight the denial, like actually just go ahead and resubmit it and that'll fix it. It should
Yeah.
fix it. Yeah, okay, that's a great tip. Yeah, oh, yeah, I've had to call a few myself. It's been a nightmare.
Yes.
Oh my gosh. Okay, let's see. Oh, yeah, we addressed that. So for the commercial payers, it's 95 and we've got all that. Okay. Oh, for the commercial payers, is it O2 or 11? What are you seeing? Because I saw some Blue Cross Blue Shields that wanted 11 and some wanted O2. So I'm just wondering, do you know, is it just totally inconsistent or what do you think
It's
about that?
totally inconsistent and it varies so much region to region. For example, like Blue Cross Blue Shield here in Texas was originally saying O2 and now they're saying 11. And so it's best to just go ahead and just what I've understood to be happening is that most insurance companies are deciding what is telehealth and what isn't based off the modifier code more so than the service location code.
Okay. Okay. So I guess whatever you feel comfortable with would be the best, pretty much. And then if it gets denied, they're going to say like location code or modifier is wrong. Then you'll know to
Yeah,
go back and resubmit or.
and pretty much what it'll say is service location code or modifier code is inconsistent with billing guidelines is typically what the error will say.
Okay. Gotcha. Yeah, that's great to know. Okay. And then, like you said, just go back and resubmit with the
Mm-hmm.
other location code or the other modifier.
Yes.
Okay. That's awesome. All right. Thank you. Let's see. Okay, these are questions from the Facebook group. Somebody said, I'm wondering if I was 100% online prior to COVID-19 and not able to successfully bill for telehealth because of the designated rural site originating thing, can I bill now for telehealth as Medicare seems to have opened it up for all providers?
Yes, absolutely. You can bill right now. And they say to use, you can use any sort of methodology of your choice, whether it's FaceTime, whether it's Doxy.me. I will say, even though they've given a blanket like statement where you can use things like FaceTime or Skype, just remember those aren't HIPAA compliant. So while the federal government may not have an issue with it, your state board may still have an issue with it.
Great point. Absolutely. Yep. Okay, so check with your state board too to see if they've waived that stuff because some of them have, I've seen.
Mm-hmm.
Yeah.
Yes.
Okay. Thank you. Okay, let's see. Somebody said the piece I'm particularly concerned about is I was not able to bill prior to COVID-19 with POS02 and with modifier GT or 95. Medicare is saying now to bill with POS11. Oh, we already addressed this. POS11
Yes.
modifier as 95. Yeah. Okay.
Yeah, we've addressed that one, but she asked if there was, or he asked if there were changes to cost sharing due to COVID. Not with Medicare. With Medicare, you're still having to use co-insurance, or they still have to meet their deductibles unless they have that, supplemental plan or an advantage plan that they're utilizing in place of that. Because if they have a supplemental plan, their supplemental plan is supposed to cover the cost of their co-insurance, not the cost of their deductible. They'll still have to be responsible for that. But the deductible is only $198 for everybody across the board.
Right.
With private
Okay.
insurances, yes, the copays and the co-insurances are being waived in a lot of instances, and a lot of it just varies again region to region. I know Aetna has made a blanket statement where they're covering cost of copays and deductibles 100%. And I've also seen that in some instances with Cigna. I will tell you though, it would be my suggestion to go ahead and collect the copays or the co-insurance until you get your first claim back from the insurance company, because in a lot of instances, they're supposed to be waiving all of those costs, but their system flags it and they're not. You have to call the insurance company and say, hey, you guys processed this claim wrong. and get them to correct it. And so it could be a month and a half before you'd actually collect any money, and then give the person a refund once everything's settled.
Yeah, because I doubt the insurance company is going to come back later and say, oh, we forgot we weren't supposed to, charge the copay. So if they don't do that, you're going to have to catch it, follow up on it, and do all of that. So it's easier just to collect it ahead of time, even though they're supposed to not be charging it.
Correct. And if they end up consistently catching it and saying, hey, we're supposed to be covering it, go ahead and refund the client at that point.
Gotcha. Okay. Yeah. Thank you. That's a great tip. Let's see. She also asked about including copays, deductibles waived, amounts paid to providers the same. Okay. What are you seeing about that? The amounts paid the same to providers that are doing the telehealth instead of the in-office visits now? Is that staying consistently the same, or what do you think?
Yeah, for the most part, they are paying at 100% of what the allowed contracted rate is when they are waiving it. That's not an issue. The only time that it comes up is if they process the claim incorrectly and you need to call them and tell them to fix it.
Okay, thanks. That's good to know. Let's see. Oh, another part of a question that we were talking about before is she said, I'm 100% online and I don't want to misrepresent myself or my practice as being brick or mortar by using 11 as the POS. And I think we sort of addressed that a minute ago, but what are your thoughts on that?
You're not misrepresenting yourself if you're 100% online and that's how you're marketing it. This is just how you're billing it, and your client isn't ever going to be they'll see on the claims whether something is paid or not in the CBT code, but they're not ever going to see the location code when they get their explanation of benefits back from the insurance company. So that's really not going to be an issue.
Mm-hmm. Okay, yeah, and the insurance company is not going to come back and say, hey, you lied about your location status, or we're going to take your money back. You wouldn't see that happening with anybody.
No, but I would just say, with all these press releases that are coming out to cover your butt, go ahead and save a copy of them so that you can reference that should they ever decide to say, hey, because I'm sure at some point because I've seen audits happen from service dates that are from 3 years ago before. And we don't know what they're going to audit from this time period, or whether they're just going to think that this was a black mark in history and they're not even going to touch it. We don't know. Yeah,
no kidding. Yeah, that's a great tip. And I recently altered my progress note just to talk about, the Health and Human Services.gov waiving, all the restrictions and allowing anyone to receive telehealth right now. I literally put that in my progress note. And I think, like you said, if you have a blurb from that particular insurance company, you might even want to consider just plop it right in your progress note when you see the client, to kind of cover yourself that way.
Yes, and you need to make sure, if you're not already, that your folks are signing their telehealth consent forms.
Okay, absolutely. Yeah, make sure you've got that for sure. Yeah, that's such a good point. Let's see, what else? Accepting co-pays, any changes that we should know? If a client gets laid off, how long can we still bill for? Those are my main issues right now. So I'm not sure what she's asking. I think she's saying how long is a policy good for if somebody gets laid off?
Well, the issue with that is a lot of people are getting furloughed and they're calling it laid off, but it's not. It's a temporary layoff just until business can start resuming, right? Mm-hmm. And so you have to check with the person's company that they're having and whether they're still going to be having benefits for folks while they're furloughed, because that's going to really put an answer to your question. But if somebody does get laid off, typically what it is you bill until the last day of that month in which they were laid off, and then afterwards insurance is no longer effective.
Okay, so the last day of the month. Mm-hmm. Okay, yeah, gosh, that's going to be a nightmare for people. Ooh, policies ending. Okay, thank you. Let's see. Okay, and then someone asked, will people with LPC licensures be able to be reimbursed now? And I think that's referring to Medicare.
I wish.
I know. That would be great.
On that bandwagon so fast.
Oh my gosh. That would be amazing, wouldn't it? But so yeah, the answer is no, because you'd have to get like totally credentialed and everything to be able to bill Medicare right now.
Yes,
Yeah,
and
unfortunately.
they're so backlogged that wouldn't, even if they were going to offer it, that's just not going to happen.
Yeah, such a shame. Okay, thank you. Let's see. So I think we might have addressed it. Well, okay, so what qualifies for online platform in quotes for Medicare e-visits?
Oh, so for the online platform for e-visits are entirely different from telehealth.
Yeah, good point. We should probably talk about that. Yeah, what's the difference? Do you mind explaining that to everybody? And
E-visits are where you communicate with your client through the client portal of your software that you're utilizing. So if you're utilizing Simple Practice, it would mean that you were communicating within Simple Practice with that particular client, and that is what an e-visit is. Telehealth is what we think of when we're doing video counseling and we're using like Doxy.me or the Simple Practice,
telehealth
telehealth
platform.
version. Yeah.
So an e-visit, like, is that like can that be a secure message through like Simple
Yes.
Practice? Is that what you're saying? Okay. How do you bill for that?
So there is a specific CPT code for that, and I will post it in the comments because I can't remember off the top of my head because
Okay.
it doesn't usually apply to most like LPCs because we typically, send a text out to our clients or something like that. But what it's really mostly used for like doctor's offices when people have questions about their lab results or
Oh,
something like
right.
that.
Okay, so therapists probably wouldn't be using that as much.
Not a whole lot, but I'll include it in the CPT comment. I'll include the CPT code in the comments just so that people have it in case they do need to utilize it.
Thank you. Yeah. So that could be just like literally one message back and forth, like, hey, how are you today? Like a
Yeah.
check-in, an e-visit check-in. Okay.
Mhm.
Yeah, I did see that CPT code. I can't remember what it is either. How much would you bill for something like that, you think? Or would you just do it
I
like
have no
standard?
earthly clue because I
Okay.
haven't ever seen anybody utilize it before.
Okay. Huh, that's interesting. If anybody utilizes it, let us know. I'd love to hear how it goes.
There is a fee schedule lookup tool for Medicare if you're not familiar with it. And you can type in the specific CPT code and it'll tell you what the reimbursement rates are per like your level of licensure.
That's right. I forgot about that tool. Okay, that's a great tip. Yeah, maybe we can put that in the comments too, so you guys can check that out if you want to.
Mhm.
Let's see. Okay, we did that one. Okay, somebody asked, does Medicare reimburse for 90853 groups, telehealth or not telehealth?
They are not reimbursing for groups right now on telehealth at all.
Oh, good to
For
know.
Medicare.
Wow, that's too bad. Okay, they're not going to pay for group. All
Yep.
right. Oh, that stinks.
So I
Okay.
guess you'll have to do social distancing with your group.
I know, that's too bad.
Yeah.
Oh my gosh, because like IOPs and stuff that are going on right now, there's a Medicare person in there. Oh,
Mhm.
that's terrible. Okay. Um, let's see. The next question is, okay, this is like a couple questions in one. Clarification of when to use 95 versus GT. That's the first question. What's your understanding of that?
95 is typically used for most commercial insurance plans, and then GT is supposed to only be used for Medicaid and Medicare. The plan, when they instituted the 95 modifier, was for GT to be phased out in when they instituted this in 2017, but it takes a while for insurance companies to update their platforms that they're using to process claims. For the most part, you still use GT for some Medicaid instances, unless you've specifically seen instructions on how to bill for telehealth from your carve-outs of your Medicaid plans. And if they say use 95, go ahead and use it. Superior, I know, said that they want to utilize. Dixie, no. Sorry, my husband left some food right on the edge of the table.
Oh, no.
So, then you utilize Superior did say you're going to utilize a 95 modifier.
Okay. Thank you. Yeah, that does clear that up. Yeah, I've been using GT the whole time. I never use 95, but I'm going to start using it because I don't know. That's just what I've been doing.
Yeah. The experience that I've seen is pretty much most insurance companies are still reimbursing when you utilize either.
Okay.
It's interchangeable.
That's what I've heard too. It seems like they just will pay for both, but yeah, 95 is the way to go. Though is what they really want you to use.
Yes.
Yeah. Okay. Let's see. Uh, this is kind of like a housekeeping thing, but like best resource for keeping track of changes with private insurances, allowing telehealth and how to code, as well as changes with providing services across state lines.
It would be looking at the specific insurance companies' billing guidelines on their website and just keeping your own personal record, because again, it varies so much region to region. I wish that they would standardize this across the board. It would make our lives so much more simple.
Oh my
And
gosh.
also with like licensure, like, having it be interchangeable across state lines, that would be great too.
Wouldn't that be amazing?
But I don't know if we'll ever get there. But it's just best to keep your own records, honestly speaking.
Okay. This is sort of a curveball. We didn't talk about it, but I have a link I posted in the group maybe last week. It was like showing which states are allowing you to like go across state lines right now. I'm imagining that's an insurance nightmare if people are trying to do that. But do you have any thoughts on that topic? I know that's probably a little off what we're talking about, but I'm just curious.
So from a billing perspective, I can't tell you what it would be like from a state board perspective, because I mean, again, that varies so much state to state. But from a billing perspective, as long as you are billing underneath your local plan, whatever that may be, regardless of whether it's across state lines or not, you should be fine. I live 20 minutes like from the Oklahoma border, so we get a lot of folks in from Oklahoma as well, and we've had no issues like billing for telehealth across state lines.
Oh, that's great. That's awesome. That's so good to know. Okay. Let me see. I think that might be the end of the questions. I just want to hop over to the Facebook group real quick and make sure nothing else has come through since we've been talking.
Okay.
Let's see. I don't think so. Let's see. Oh, it looks like somebody else has been answering some questions in there.
Good for them.
Yeah, thank you.
Yeah.
We need all the help we can get. Oh, of course, now it's not coming up. All right. I don't think I saw any more questions. Let me come back to you. Okay. I'm just going to look on my phone real quick. Is there anything else you can think of that like people should know, or stuff you're running into with all these changes going on?
So just a few like tips that I have would be, if you get when you're calling insurance companies, if it says the number's no longer in service or that it's been disconnected, that's because so many people are calling in all at once. It's not that the number's been disconnected. So keep calling that number. You'll get through the fourth or the fifth time.
Wow.
The other piece that I have to say is some of the platforms are struggling. I've heard some people struggling with like internet connection quality through like doxy.me. I personally haven't experienced issues with it, and I don't know if it's because of the overload of how many people are utilizing it, or if it's because their internet connection just sucked wherever the client was or wherever.
I know. That's been my experience. It's the other end is usually poor.
Yes. The other piece that I do want to add to it is just remember, like I saw a press release that came out like maybe 2 or 3 days ago about Zoom not being as secure as it should be.
I saw that. Yep.
Yeah. So for all
careful.
the providers out there that are utilizing Zoom as their telehealth platform, you may want to reconsider it.
Yeah, and I saw some tips somewhere about like make sure you're using a password for your meeting rooms, and there's a couple things you can do to make it a little bit more secure. But yeah, make it a unique meeting room each time instead of like I have a link I always use. This is my Zoom room, but trying to do different links, generating a new link each time. Yeah. Such a good point. There was one other question. We kind of already talked about it, but Carolyn just asked. We already have the experience of insurance companies calling back payments after an audit. What assurances do we have that the insurance companies will not claw back payments or withhold payments related to this public health emergency once it's declared to be over? I think that's basically what we're saying. Just like totally protect yourself in your notes, have documentation of why you're billing that way, right? I mean, could you think of any other?
Yeah, save all of your documentation and take a look at Simple Practices video that they put together about billing telehealth,
Oh,
specific
right.
utilizing telehealth. I mean, because that's really going to help you guys, because there are certain things that you need to have in your notes for telehealth that otherwise you don't typically need. Like you need an actual um, how long the session lasted, not just from like a 1 to 2, right? It's got to have an exact start and stop time. So if you started at 1:02, it better say 1:02.
I know. I need to change that in my notes. I do not have that in my notes. I really need to do that. Yeah, that's a big deal. So like literally the time you started, the time you ended, and make sure it's
Yes.
like at least 53 minutes if you're doing a 90837 and all that stuff. Mm-hmm.
Yes, absolutely. So yeah, just make sure that you have all your I's dotted and your T's crossed with documentation. I know that like for Medicaid guidelines, they typically require that all of your notes have an electronic signature within 48 hours of your session that you had with somebody. So just making sure that you don't give them a reason to claw it back, because especially I speculate, and again, I'm not trying to incite fear in everybody, but when when a lot of insurance companies are covering the cost of copays and deductibles, they're doing it for PR purposes. They're not doing it for the benefit of the client.
Mm.
Maybe some people are good-hearted, but I'm a little bit cynical. But it would be my experience that they would be trying to get that money back in the future somehow, some way. Like, for example, United Healthcare had the lawsuit
Oh, right.
a few years ago,
Mm-hmm.
where we don't have to get a pre-auth for 90837 now, and we can actually bill for it, and they gave people raises in most instances. Well, now they're actually trying to bury you in documentation with it. I've seen it time and time again where you're having to release your progress notes so that you can prove medical necessity for a 90837.
Mm. Oh my
So
gosh.
it's not, I wouldn't be surprised if insurance tried to do some tricks about this later on down the road. So just cover your butt.
Yeah. Oh, such good tips. Absolutely. Thank you.
Yeah.
And could you just tell everybody about your services that you offer? My group is for people that want to learn how to do your own billing, but not everybody wants to do that. So Brittany is here to help with all that other stuff that you don't want to do.
Yeah, so we help out with credentialing on insurance panels, and pretty much the applications are the same like for every insurance company. It's just a matter of Googling it. So really it doesn't matter what state you're in, we can still do it for you. And then we offer scheduling as well for private practices. So folks who are looking at um, um, needing their phones answered or emails answered, we help out with that. And then we also help out with billing. And maybe you want to do your own billing right now, or maybe now's not a good time to do it because you can't afford to spend 3 hours on hold with an insurance company for one question when you have 10 billing questions you need to get through because of your denials.
Right.
Yeah, so it doesn't matter how big or small you are, we can help you out.
So you can help follow up on claims without being like doing the full billing service for people?
I
Or,
actually do. I don't do that any
oh,
longer
okay.
because
Okay.
I have to put boundaries in somewhere.
Yeah.
And
Oh, yeah. I was like, wow, that's amazing. Okay.
I typically do. And
Okay.
after this virus crisis has passed, I'll
Yeah.
do that again. But right now it's on pause for that because the hold times
Gotcha.
are so long. But we charge by the hour if you're just needing help with claim issues for
That's
that,
awesome.
because you may or may not get reimbursed for whatever's wrong with your particular claim. And if we spend 5 hours fixing something for you, then and you realize, hey, it was just because their coverage terminated at the end of it, then you're kind of out of
Oh,
luck.
right. Oh.
Yeah.
Okay. Well, that's great.
Yeah, so we offer that, and once the crisis is over with, we'll start offering it again. We used to do like cleaning up books and stuff, but I prefer to outsource that to Carrie Silverberg. She's great at doing that.
Oh,
So if
great.
you need your accounts cleaned up for whatever you've got going on because you've got unallocated amounts or you didn't input EOBs for a year, she's a good resource to have for that.
Oh, wow. Yeah. Okay. Oh, that's wonderful. So we can, hopefully we can drop our information too, and
Yeah.
all your links and everything so they can know how to get a hold of you.
Yes.
Thank you so
And
much.
for folks who are worried about their practice too, I've just put out a blog post on my website that is basically saying, hey, here's what you can do to still help your practice grow in the midst of this that's going on.
Oh,
And I'll put
wow.
that in the comments as well so that you guys can check that out just in case that's the fear in the back of your mind.
Awesome. Thank you. I
Yeah,
appreciate
not
it.
a
You're always such a
problem.
big help for everybody.
Yeah, I try to.
I love it.
So
Thank you. I
yeah.
appreciate you so much.
Yeah, it's not a problem. Just thanks for asking me to do this because I mean, it's just if we can help get the information out there because I know that there's a lot of confusion going on for a lot of folks.
Yes. Thank you. Well, I will end this meeting. It's so nice to see you. Let me go ahead and stop this.